Assalamualaikum and greetings to everyone. In this video presentation for Health Informatics, we, the Group 5, would like to present on our discussion on the topic of the challenges of applying PMS in healthcare settings.
Patients monitoring system are collections of machines or equipment used to constantly monitor patients through various vital signs and warning systems to detect and record changes in patients' well-being. The application of PMS depends on several aspects such as demographic growth, improved connectivity, and remote monitoring and technological advancements. These digital technologies are widely used in the world to capture and monitor health data from patients and transmit electronically to healthcare providers to aid in assessing, diagnosing, and ultimately treating health conditions. This technology is revolutionizing the way healthcare is delivered by reducing costs and improved outcomes for patients. However, there are also challenges faced in the use of PMS, which will be explored and discussed in these presentations.
First challenge in applying PMS in healthcare settings is user-related challenge. In reality, challenges in applying PMS in healthcare settings is primarily in response to the user of the system. The non-contributing factors of this challenge is comprised of 4 aspects, which are the different levels of user digital literacy, lack of technology acceptance, lack of enough commitment to use technology, and weak communication between caregivers and patients. Apparently, these factors could create a rotating cycle, which that there's the existence of the interrelation between one aspect to another. In this challenge, level of digital literacy of the personnel is the center of the success or failure of PMS application in healthcare settings. It needs to be agreed that the lower level of digital literacy could decrease the confidence, attitude, and commitment in using technology by healthcare personnel. In subsequent events, this could adversely affect the safety and quality of the patient care. In fact, this illustrated situation is equivalent to a study conducted by Webb and Happiness in 2019 on assessing digital literacy levels and attitude of healthcare service staffs on the technology and information system in healthcare service. This study is participated by 407 healthcare service staffs, with about 60.4% are younger staffs, particularly aged lower than 50 years old, while older staff with the age above 50 years old comprise 39.1% of the total respondents. From the survey, about 70% of the total respondents showed high level of digital literacy and confidence in utilized technology in healthcare settings. Nevertheless, high digital literacy were majority showed by younger staffs compared to older staffs. In addition, about 1/5 of the staff were reported to have anxiety in using information technology. Therefore, as nearly 40% of the total respondents are older healthcare staffs, this challenge is still evident, concerning, and also far from success in reducing this problem, unless extensive and assistive digital literacy courses were provided to this group.
To apply patient monitoring system in healthcare setting from aspect of infrastructure challenge, it is not under control of the developer but related to standard regulations such as insurance coverage and communication technologies, for example, Bluetooth, Wi-Fi, cellular data connection, and their technical features. From aspect of specific standard, infrastructure barriers are sometimes due to lack of specific standard and low level of awareness of available standard. For example, as we can see in India, most of rural residents there are lack of awareness regarding recent technologies in medical treatment, which may be due to their low educational status and still depend on traditional method in treating disease. As the system are used for patient monitoring, they are required to be evaluated based on standard approved by officials on a regular basis. But lack of human power that have expertise in this area is very common in rural area of India, as example, which lead them to unable to fulfill the specific standard as required. In context of connectivity structure, communication-related challenge in the case of cellular data connection and Bluetooth need to be checked in terms of sustainable connectivity and pairing. For example, in rural area of Sabah or Sarawak, the problem arises due to lack of technology investment there and lead to unable to apply modern treatment that require advancement of technology. It is necessary to ensure that, in case where this limitation cannot be resolved, the use of the system is stopped due to the patient safety.
Next, we are going to look into the process challenges. The transfer of information required for patient monitoring system to boot is potentially a long and complicated process and consists of multiple transfers. Firstly, data must be collected and uploaded from the patient device. If this device is on a mobile network, the data must be traveled through that network provided infrastructure and out onto the internet before ending up in the service provider's network, probably via multiple data centers and the RPM platform network. If any of these hopes is interrupted or an outage occurs at any of this stop on this journey, the data might be delayed in getting to the destination. Process challenges are not related to a specific part of the system and must be considered in every component of it. In these challenges, several difficulties including security, for example authentication and authorization, confidentiality and ethical concerns were identified. First identified process challenges is the data security. Since remote patient monitoring systems store and process sensitive data, electronic health records, diagnostic results, and etc., proper security and privacy have to be ensured. Healthcare is a highly regulated industry, so it is crucial to achieve compliance with all the required standards. It is worth noting that the users and wearables are highly concerned about the confidentiality of data they share. To ensure security and compliance, healthcare providers have to implement features such as two-factor authentication, role-based access control, and data encryption. It is also important to instantly detect suspicious activities, assess risks, and prevent threats with full-stack infrastructure monitoring. Next process challenge is the confidentiality. Although there are no universally agreed standards for healthcare privacy and confidentiality, certain principles can be distilled. These principles incorporate ethical considerations and include concern for data protection and an individual's right to review and access their information, specific consideration for what information will be shared with whom and for how long, transparency about how feelings and privacy and confidentiality will be managed. Last process challenges is the ethical concern. In determining the balance of clinical utility and right to privacy in remote monitoring, clinicians essentially make judgments about potentially conflicting ethical claims. The three commonly accepted principles of medical ethics are respect for autonomy, non-maleficence, and justice. Respect for autonomy is encompassed by the granting of informed consent for remote monitoring. An individual patient is required to provide informed consent for remote data collection, transmission, and reporting to occur and should provide this permission specifically, voluntarily, and with mental capacity to understand the consequences of their decision. Non-maleficence in remote monitoring is primarily concerned with confidentiality and data security and the obligations of responsible parties to avoid data loss either inadvertently or as a result of hacking. Justice in healthcare requires that each individual is treated fairly and has equal access to healthcare.
Number 4 is management challenge. In any production system, there is a tendency towards variation in quality due to natural variation due to change and failure to conform to set specification. The role of quality control is to reduce or eliminate variation that are outside acceptable limits. In order to operate a high level of accuracy and certify the level of acceptance in quality standard of PMS, professional and technician with vast spectrum of knowledge and skills in managing quality control and maintenance of the system is extremely required. Nonetheless, shortage of capable individuals with this mentioned skill and knowledge in the industry will affecting the overall quality in the healthcare delivery system. High quality patient care relies on the motivated and skilled workforce who not only are physically and mentally well enough to do their jobs, but also valued, well supported, and engaged. In short, help desk is a service that assists users when they have a problem with an application or piece of the software. In a healthcare setting, this could mean a help desk that assists physicians and other healthcare staff when they have a technical or IT problem. Generally, help desk is provided by most manufacturer and supplier companies of PMS devices in order to assist their client on the problem or maintenance required for the purchases devices. However, poor help desk support will be challenging in operating PMS in the healthcare setting, as it commonly takes around 82 hours to resolve the help desk request and over 7 hours to provide initial response. As contacting the help desk is mainly through conventional medium, such as through phone call or email, the poor time response by help desk might, due to high telephone line traffic or multiple emails received that needed to handle by the help desk at the same time. Hence, late response and support by the help desk will cause escalate the problem of PMS devices, wasting much time and also increase the cost.
Next is resource-related challenge. For this challenge, there consists of few elements that involve, which are firstly is hardware. Factors such as design, where weight and industry design issue of the monitoring device, for example, bulkiness. Next is potential risk for patients, such as patients get the wrong medication due to the selection of the wrong item from drop-down list. Then vulnerability, where ill functioning of the system that can lead to the medical error and negative effect on care outcome. Patient and personnel, mistake in documentation, for example, data manipulation and rewriting, misrepresentation, and violation of patient legal right. And lastly is energy consumption, where these factors related to the telecommunication industry include reliability, sensibility of connection, sudden interruption of telecommunication network, scalability in terms of data rate and power and energy consumption, for example, internal design, quality of service, and energy efficiency. All these factors should be tested in a pilot survey by a specialized team. Secondly is software. In this element, proper attention to the theoretical concept in the design process is crucial. It is important that user-related problems be considered through user-centered design. Factors that should be considered are about poor design, where lack of standardization in the design and presentation of monitoring information between different manufacturers and hospitals, and also lack of intuitiveness in interface design and the importance of customizability. For example, most EHR, intensive care center, ICU, or vital sign monitor and efficient device may have different methods of presenting the patient-identified information. Thus, it requires users to acknowledge the acceptance of interdata in different ways and providing selection option for data input choice. The other factor is usability, which if the display of information in current monitor confusing, for example, the information is number code and interpretation requires skill, hence participant feel overloaded with information. Lastly are cost challenges, where if some issue or problem happen, and also in order to update to the new system or model system to be more advanced, the cost of system implementation, maintenance and update system require huge amount. Thus, sufficient and sustainable financial resources need to be available before and during project implementation.
The last challenge is training-related challenges. Training-related challenges are the issues that come due to lack of user training. Some staff find it quite difficult to adapt and use advanced technology. The example of advanced technology is intelligent asthma monitoring. The use of this system is more challenging, especially among older staff. Inadequate trained staff can lead to poor job performance and lack of competency. For this issue, it is highly advised for the management to send the staff for training to keep them updated with latest system and technology. This can increase the chance of success of patient monitoring systems.
In conclusions, by identifying the challenges faced in PMS could give benefits in patients' healthcare. In the user-related challenges, the level of digital literacy of personnel is the center of the success or failure of PMS applications in healthcare settings. Second, infrastructure challenge we are not under control of the developer and consists of several aspects such as standard and communication technologies. Other than that, management challenge including the quality control of patients' care and healthcare support. Infrastructure also one of the challenges in PMS, such as the hardware that we use and software in developing the system and the cost of implementation and maintenance. Lastly, the training-related challenges that arise from lack of training could lead to poor job performance and competency.